This is Jose Merino, Editor-in-Chief of the Neurology family of journals. The Neurology podcast provides practical information to neurologists and other clinicians to help them provide better care for their patients. Thanks for listening and have a great week.
Hi, this is Stacey Clardy from the Salt Lake City VA in the University of Utah. Today on the Neurology podcast, we're joined by Aaron Baldwin. Aaron is a genetic counselor at the University of Pennsylvania Neurogenetics Therapy Center and the first author on a paper published in Neurology. The title is Disparities in Genetic Testing for Neurologic Disorders. Aaron, thanks so much for joining us, and I want to jump right in. We've got a lot to cover. As I understand it, for this project, you were testing a hypothesis that access to genetic testing might vary according to a number of variables: race, ethnicity, sex, socioeconomic status, insurance status, many things. And so you looked between 2015 and 2022, so a pretty recent cohort, retrospectively, from patients there at UPenn who underwent genetic evaluation through Penn's neurogenetics program. So I think you said in the paper, the neurogenetics program pools referrals really from all the outpatient neurology clinics. So for your time range, that was about 128,000 patients. And of all those patients seen, about 2,500 patients underwent genetic evaluation. Did I get that right?
Yes, Stacey, that's spot on. It was around 2% of the patients that we looked at for genetic evaluation when looking at all patients seen in outpatient neurology. And we really wanted to bear down on that 2% and really get a good idea of the demographic factors that were at play there.
And I've got to imagine that percentage is just going to go up from 2% as genetic testing really continues to grow in popularity and hopefully affordability over time. So my question right off the bat for you, with that population, what's the punchline? Did you find any disparities in who underwent genetic testing for any of those variables?
The answer is absolutely yes. We found some pretty strong findings from our research. The first was that we found that patients from the lowest quartile of income in the city of Philadelphia were less likely to be seen in neurogenetics or for a genetics appointment for neurology subspecialty. Of additional interest was that we found that Black or African American patients were half as likely as white patients to be seen in neurogenetics or to have a genetics evaluation for a neurology indication. And I think that was, very telling for us to see such a stark difference between different demographic and ethnic groups in the city, especially when our final finding, which I think is of most importance as well, is that all groups had the same rate of diagnosis, rates of positive genetic testing or hit rates after completing genetic testing, which suggests that all patients really benefit equally from having this service and having this ability to have a neurogenetics evaluation and potentially complete genetic testing.
So that answer leads to a lot more questions for me. First of all, how did you control for confounding? How did you make sure that certain ethnic groups, races were not hit with a double whammy, if you will? So was the lowest financial quartile corresponding to sex or ethnicity in your population? And if you controlled for that, what else did you find? Get me a little more into the details of who really did not get the opportunity to be tested.
So what we looked at, we're again looking at neuro indications across these different demographic groups. And so one thing that we started off with was a multivariable analysis to kind of look at the overall demographic factors and how they might impact the probability of a patient coming to see us in neurogenetics. But we also completed univariate analysis to examine the relationship between demographic factors for the reasons you just listed, which I think are very important to keep in mind here. Specifically that, many ethnic minority groups or groups from lower socioeconomic status can be impacted by multiple factors and multiple demographic pieces that can all come together to cause disparity or differences in care. And so we actually broke down our demographic groups through this multivariable analysis to be able to pinpoint each individual demographic category to see if there was any statistical significance. So again, in doing our analysis or multivariable analysis to look at the different demographic groups and how they might impact one another, we found that being African American or coming from a Black background was impactful in your rate of being seen in neurogenetics, so a 50% lower rate. We did not see differences across demographic groups when it came to once they got to neurogenetics, did they complete genetic testing? We saw the same rates across all demographic groups there. And that kind of points us into thinking maybe that the point of disparity here might be at the referral level or which patients are actually coming in for a neurogenetics appointment, because after that, we didn't see any statistically significant differences.
So that's a really important point right there, because this is something that we can all address in our individual clinics starting right now today, right? So if it is that some people are not getting the referral, we could perhaps just protocolize this, right? Like if you come into a clinic with the following phenotype, everyone is offered a referral. Does that seem like it might be a good idea to you? Or what other suggestions do you have, Aaron, in how to address this right now that I can do this week?
Stacey, I think that's a great point. Really hitting home on the background of our research is wanting to kind of give some more guidance on best ways to approach these groups that have been historically underrepresented in medical work, including genetics. And I think one thing that we can do as neurologists in the neurology community can be just aware of this disparity. Know that African American patients and many other minority groups are at a lesser likelihood of getting to that neurogenetic stage to have a full evaluation and to have genetic testing. On our end, we're very proactive in feeling like if a patient is interested in doing genetic testing, if there's any kind of family history of a condition that we know, there are genetic testing options and possible diagnoses that could come from that indication. We feel like all those patients should be seen and should at least have the opportunity to learn about genetic testing and genetic counseling. One thing we like to say, which I really love to hammer home as a genetic counselor, is that meeting with the genetic counselor doesn't mean that you necessarily have to complete genetic testing, but we think it can be an important tool to not only explore what genetic testing could mean for someone, what kind of impact it could have on them and maybe even their family, but also give them the information that could be helpful in coming to a diagnosis, or at least knowing that these kind of services are accessible and could be helpful in understanding someone's medical diagnostic journey.
And Aaron, do you think there's some contribution of clinicians making assumptions here about if a patient can perhaps afford something, and then maybe they don't want to make the patient feel badly, and so they're reluctant to offer the referral to testing? Because I think we all have a sense that genetic testing is still fairly expensive, and it is in many cases still not covered by insurance, especially for adults. So I wonder if physicians are holding back a little bit, thinking, oh, why am I going to bring this up if I'm afraid that it's not going to be accessible to a given patient sitting in front of me? And so I think you did look at some variables of this as a surrogate, right? So zip codes and things like that. I'm interested in your thoughts here.
You're spot on, Stacey, in thinking about, how a lack of insurance coverage or lack of income could certainly impact your ability to be able to go to a neurogenetics appointment and also potentially pay for genetic testing. Genetic testing and insurance is a tough battle that we're fighting against many insurance companies to come to costs that we think are acceptable for patients. But what I would say is that if providers are concerned about costs, you do have a lot of strategies to ensure that a patient isn't burdened with additional costs that they weren't expecting. Many labs will run benefits investigations. So looking into the cost of testing ahead of getting started. And our group is very proactive and strong about letting patients know about these opportunities, know that we will submit through insurance. And then finally, I would say that there are some situations where we can do genetic testing through research-based proposals where the cost to testing to the patient is very low. So we really do our best to try and connect patients with testing in some capacity, whether it's a panel or broad-based testing. And I do think that fear by providers of a patient not being able to pay for testing is warranted, but we would still think it could be important to have that conversation with the patient and make sure that they're not only aware of what genetic testing can offer, but also some of the limitations that might come from cost and having to pay for it.
Yeah, so you're really emphasizing here, you still need to have the discussion, right? I mean, this may be part of the problem is making assumptions, right? And so let someone with expertise like a genetic counselor really dig into this, because it's only one of the issues that really needs to be explored beyond the scope of the time we usually have in a neurology clinic visit, right? And I could maybe scratch the surface of implications of a potential positive result, but I can't get into it in depth.
I would completely agree with you, Stacey. I think it's one of those things where I think it's still worth giving information. Information can be power for many of these patients and their families. And you'll have to remember that when it comes to a genetic diagnosis, it's not just the patient that's impacted. It's family members that could have inherited or have similar symptoms, inherited a similar genetic cause of their disease. And I think one important point here is as time is going on, we are advancing in both neurology and general genetics and therapies to start having therapies that are specific to a specific gene or condition. And by not offering this genetic testing to all patients, relieving some of the groups that have already been misrepresented in medicine and the modern medical world behind even further if they're not able to move forward with a clinical trial or a new medication that comes up in the next couple of years because they were never afforded that ability to have genetic testing, have it explained to them, and potentially get a result that would make them eligible.
Yeah, that's a great point about furthering the problem if we don't address just the simple things now. This is a little bit probably beyond the scope of your paper, but have you encountered issues with trust around genetic testing? And I'm thinking especially for groups who have not been treated well by the medical system historically. Do you find in some of the conversations that you're having that this comes up as an issue as well? I have got to imagine when I think about genetics, I get sort of more paranoid more quickly about that sort of data being out there than I do, say, CBC or just a standard blood test. Have you encountered this in discussions when you're having them with patients?
Stacey, I think that's another really good point. It is a little bit of a more of a sensitive topic to talk about genetic data, things that can be identifiable. But one thing that is very important, we think, from a genetic counseling perspective and a genetic testing perspective is just explaining to patients what kind of protections exist in terms of their privacy from having their genetic data released. For all of our patients, we give options to move forward with release of all their data for later research, and that's completely a patient option if they want to move forward with that or not. But I think you bring up a great point when thinking about marginalized and minoritized communities who have historically had mistrust for the medical community for good reason. And I think that it's really important to at least have this conversation about, is there mistrust? Sometimes that's a question that we can ask during an appointment in a neurogenetic session, just asking, are there other factors at play that are playing into your decision to move forward or not? And that's part of, I think, what's an important piece of genetic counseling is kind of exploring these different ideas, concepts, backgrounds, frameworks that might be playing a role in this person's decision to move forward or not, and exploring what factors are at play. And if we can give feedback to the patient saying that their data is private, gets destroyed by the lab after X number of years, I do think that can really help with establishing trust back with those groups and those communities and allowing for better health outcomes for those groups as well.
I'm hearing you say, look, just come out and ask the question. Are you concerned about trust? Are you concerned about the data? What questions do you have? Also, making sure that we are making the same referral options available to everyone, right? Like, don't try to overthink this and try to say, oh, well, I don't want to set someone up to be disappointed. Well, just discuss it, put it on the table, and see what the reaction is. So I've heard those two things. Any other suggestions you have for us?
Another piece I think that could be important is for neurologists, when making a referral, maybe erring on the side of caution. There are many referrals that are made based on a pertinent family history that might include multiple family members impacted by a condition. And we also have to keep in mind that not everyone has the same ability to have a full medical history on their grandmother and grandfather or their aunts and uncles on one side of the family. And I do think that it might be better to err on the side of caution for cases where we're really unsure about the cause, when there's not a straightforward understanding of the family history. And I think that could be really impactful for a patient and their family members, especially moving forward if there is something genetic that's discovered through testing. Over time, most of genetic testing and genetic research has been traditionally completed on white patients from the in-group in the United States. And I do think that not having African Americans involved in that research can increase or decrease the sensitivity of them being able to find a result that is applicable to them. But I think the other point that we especially see in neurology, which I think is really important, is that we're still learning so much more about disease and gene associations within this space, especially when it comes to neurogenetics. It's one of the newer subspecialties when it comes to genetic testing and genetic analysis. And we'll only be able to learn about differences in phenotype or phenotype-genotype correlations, or differences in the way that people can present with a condition, even if it's the same gene in the same family. And we're still learning more about those differences. And I think including people from all backgrounds is imperative for us to be able to move forward and make sure that we're giving everyone the best medical health outcomes and treating everyone equally.
Absolutely. Point well taken. And while experts like you work to address this at the national level, it seems clear to me that there's a lot that we can do in our individual clinics. And so this has been very educational for me and helpful to make sure that as an N of one physician, I'm doing my part. So Aaron, thank you again. This is really relevant, important work on disparities that is actionable and will allow for easy, immediate change. at the level of just a regular old neurologist like me who's no genetic expert, but I certainly have access to geneticists. So thank you.
And thank you so much for having me on today. It's been really great to talk about what we feel obviously is a very important issue. And we hope that this just streamlines and gets more research started for us to only improve moving forward. So thank you.
And Aaron's paper, again, is in Neurology now, and it's titled Disparities in Genetic Testing for Neurologic Disorders. There is a lot more detail packed in there about all of the demographic groups and the confounders that they controlled for and the conclusions they found. So take a read. Thanks so much. This is Stacey Clardy, your podcast editor. If you've enjoyed the podcast, please take a few moments to subscribe, rate, and review the Neurology podcast through Apple Podcasts, Google Podcasts, Spotify, or wherever you listen. And remember, you can always head to neurology.org/podcast for our full list of past episodes. Or you can also search by keyword in your podcast app for any neurology-specific topics you want to learn about.